How are you doing? I'm Dr. Joseph Kozina. I've been a practicing interventional cardiologist at Mercy General Hospital since 1989. Are you feeling okay? You're not having any problems with chest pain? I've been involved in thousands of cases since that time. Why don't you hop up here and let me take a good listen to you. I believe myself and my group enjoy a very good reputation. All of the interventional cardiologists here at Mercy are board-certified interventional cardiologists, and every 10 years you have to take your recertification courses to maintain that privilege and that status. We put in 50 to 100 hours of continuing education credits going to courses. It's required by law, but it's just required by our desire to be the best. I'm very proud to work at the cardiac catheterization laboratory facilities here at Mercy General Hospital for several reasons. One, it is the highest volume laboratory in the state of California. The pressure that I'm reading there is your systemic 99/75. The benefit of a high volume center has been proven multiple times. Very large trials have shown that high volume cardiologist, that means someone that is doing many procedures, has better outcomes than a lower volume operator. The same is true for facilities. And that makes sense, right? The more you do something, the better you are. The success rates in our laboratory are some of the best in the nation. We're identified nationally and even globally as a center of high excellence. You have to be involved with ongoing research. You have to have an excellent rapport with the industry. And so as a result, we're privileged to be involved with virtually every new device, every new modality, every new medication that comes on the market. And that keeps us on the leading edge. You got perfect anatomy for this procedure. We're a 24-hour-a-day, 7-day-a-week, 365-day-a-year operation. To adopt a program like this is not easy. It means dedication. And fortunately, we have the physicians in this facility to do that. Everyone is committed to the best outcomes to these patients.
What we do is we try everything in our power to make the patient comfortable with the procedure.
Our cardiac catheterization laboratory crew is by far the best in the state of California. The crew is a very mature crew. They've been around the cardiac catheterization procedures for years. They can just read me like the back of their hands. Right here where my finger is, I'm going to be giving you a little bee sting, okay? The procedure begins with us numbing the groin area with a lidocaine type drug, so that you feel no further discomfort. You will also receive sedative medications before you come down to the catheterization laboratory to ease any anxiety that you might feel about the procedure. We will place catheters or plastic tubes to your heart through the major vessel in your body called the aorta. Take a quick picture of how well your heart is pumping. We take many different projections, and so you will see a camera moving around your head. We'll then pass a small plastic catheter with a balloon on it, that's called an angioplasty balloon, to the area where the artery is narrowed. We'll inflate the balloon and we'll essentially crush the narrowing into the wall of the artery. Once that's done, we'll remove that balloon and then bring a second balloon in that has a stent, and we will make the stent fit perfectly so that you get the best possible result. You really don't have anything here that really should be in the way of you kind of doing whatever you want to do. Yes, you might notice. I absolutely love what I do. There's nothing like taking a patient to the cardiac catheterization laboratory as an unknown, figuring the problem out, fixing the problem, and sending the patient home the following day to enjoy the rest of their life as though this was just a bump in the road. So you'll be able to go home in probably 4 hours. We've really come to the point in cardiovascular medicine that treatment of this malady, this coronary artery disease, has really now just become a mere nuisance as opposed to a major change in a person's life. And to watch that transition occur over my 17-year career has just been amazing. I'm delighted as well. Now you have family with you today, and I'll go out and talk to them. Okay?
They'll be delighted.
Yeah. So as far as your ticker is concerned, you're going to be around for a good long while. I can't guarantee you an outcome. I don't think any physician can guarantee you an outcome. We can tell you what the risks of the procedures are, and we can tell you that the hospital staff will do their best to give you the best possible attention. My guarantee to you is that regardless of outcome, I'm going to give you 110% in terms of my effort and my skills.